Okay, let's dive into this. We're talking about a medication that's a bit of a paradox, right? On one hand, it can be an absolute lifesaver. On the other, it's packed with some serious risks. So, in this explainer, we're going to take a guided tour of a drug that can literally stop a crisis in its tracks, but comes with some heavy-duty warnings. We'll break down what it is, when it's used, and explore that critical balance between its power and its peril.
So, to set the stage, just imagine a really high-stakes scenario. You've got a patient in a hospital, they're severely agitated, and they're a danger to themselves and maybe to others. What if I told you there's a medication that can de-escalate that whole crisis in just a matter of minutes? Well, that's exactly what we're talking about today.
And that medication is Olanzapine. It belongs to a class of drugs called atypical antipsychotics. You can think of them as kind of the next generation of psychiatric meds. See, their job isn't to be a sledgehammer. It's to very finely tune the brain's communication system, especially those key chemical signals like dopamine and serotonin.
Yeah, this master key analogy is just perfect. Think about it. Instead of a key that fits only one single door, Olanzapine fits a bunch of different locks in the brain. And by gently turning those locks, or antagonizing them to use the scientific term, it quiets down all that noise from overactive brain signals that can lead to some really severe symptoms. It's all about bringing things back to a calmer, more balanced state.
Okay, so when you have a tool this powerful, the million-dollar question is, when do you actually use it? Let's get into its real purpose and power in a clinical setting.
Right off the bat, this is not a medication for just a bad day. We are talking about serious, acute situations, like severe agitation where someone could genuinely hurt themselves or someone else. But it's also a really crucial long-term tool for managing chronic conditions like schizophrenia and bipolar disorder, providing stability where there used to be just chaos.
And here is where Olanzapine really, truly shines. It's speed. I mean, in a crisis, every single second counts. And as you can see, an IV dose can start working in as little as 5 minutes. That is incredibly fast. And get this, its effects only last a few hours. That's kind of the sweet spot, right? It's long enough to calm a dangerous situation, but not so long that it becomes this heavy, long-term sedative.
But all that power, well, it has a flip side. And this really brings us to the core tension of this whole explainer. Olanzapine is absolutely a double-edged sword. For all its amazing benefits, it carries some pretty significant risks that need careful expert management. So let's break down these risks. It's actually pretty straightforward. Think of contraindications as bright red lights. These are the absolute stop, do not proceed scenarios, no exceptions. Then you've got adverse reactions, which are more like yellow lights. Proceed with caution, and you've got to watch very, very carefully.
And here are some of those yellow lights we were just talking about. Olanzapine can cause some wild swings in blood pressure, and it can even affect the heart's rhythm. And yeah, sedation is expected, but sometimes it can tip over into actual confusion or delirium. And then there are these things called extrapyramidal symptoms, which is basically a technical way of saying movement issues like tremors or stiffness, all things that have to be monitored really closely.
Now this is a big one. One of the biggest risks with Olanzapine is how it plays with other drugs. If you combine it with anything else that slows down the central nervous system, we're talking opioids, alcohol, benzodiazepines, you are absolutely playing with fire. That combination can lead to really dangerous levels of sedation and can even slow down a person's breathing.
So, with all that in mind, how in the world do doctors and nurses use this double-edged sword safely? Well, it all comes down to getting it right, and that means precise dosage and the right delivery method.
It's all about having the right tool for the right job, isn't it? For those emergencies, Olanzapine comes in vials, ready for injection, to get that super fast action we talked about. But for ongoing, long-term management, it's available in a whole range of oral tablets, so the dose can be tailored perfectly to what each individual patient needs.
This table gives you a fantastic snapshot of just how carefully the dosage is managed. So an adult might get a 10 milligram injection, but look at the pediatric doses. They're often way lower. A young child might get just half the adult dose. It's this exact kind of careful calibration that's so key to tipping the scales toward benefit and away from risk.
All right, let's wrap up with the fine print. These are the really important special considerations where a clinician's judgment is just absolutely paramount.
This quote from the clinical guidelines, it just gets to the absolute heart of the challenge. I mean, just imagine for a second trying to give an injection to someone who's extremely agitated and maybe even combative. It's not just some simple medical procedure, it's a super high-stakes, hands-on situation that requires incredible skill and a really calm head from the healthcare team.
And believe me, the warnings don't stop there. During pregnancy, it's a really tough call, a genuine risk versus benefit dilemma. For anyone with a history of seizures, it has to be used with a ton of caution. And we really can't say this enough, combining it with benzodiazepines is a major no-go, all because of that risk of severe, dangerous sedation.
So, what's the bottom line here? Look, olanzapine is not a magic bullet. It's an incredibly powerful tool for sure, but its use is a constant, delicate balancing act. Every single time it's prescribed, a clinician is weighing that potential for immediate, maybe even life-saving benefit against a list of very real and very serious risks.
And that really brings us to our final question to think about. We've seen the science, we've looked at the data, we've heard the warnings, but how do doctors and nurses actually manage this incredibly delicate balance, moment to moment, with real people in the middle of a crisis? It's a powerful reminder of the skill and honestly the humanity that's at the very heart of medicine.